Let's talk about the advice that only Preston will likely give you. Please, please don't be afraid of saying the wrong thing. I want you to actually make a goal, which is to try to say the wrong thing more. And here's what I mean by that. We often, and me especially as a med student, found myself being completely paralyzed when I was in a difficult patient interaction and I was so worried about saying the wrong thing. They would express some terrible thing about their life or their delusions or their hallucinations, and I would just go, ugh. And I wouldn't know how to respond as a doctor. I'm like, I'm the professional doctor, the medical student. How do I respond? Sometimes you can just respond as a human. And I found that when I made mistakes and responded as a human to people, the authenticity that carried through gave me so much more benefit. And here's the other thing. If you spend the entire time paralyzed about saying the wrong thing, you are missing out on saying the right thing. The next Preston-only advice is please use the word I. Use the active voice. I don't know why people do this, but I think it's in a hope to diffuse blame or to be passive. But let's say a patient says, why aren't you discharging me? And then you go, they can't do that because we're worried about X. Say it. Say, I don't think it's right for you to go home at this point. Own your decisions. It's really helpful, especially in psychiatry, to be authentic like this. Sometimes patients will ask me, what's the prognosis for this? What's gonna happen to me in the hospital? How is this gonna go? And the times that I've looked them dead in the eyes and said, I don't know, but I will find that answer for you. And as soon as I know, I'll come back here and I'll tell you. It has gone way better than when I tried to hedge and use some kind of passive voice. Actually, just yesterday, I without skipping a beat, said, the answer to that is, I don't know. And the patient said, I really appreciate the honesty, thank you. It shows that you're an authentic human who has mistakes and is fallible, and patients respond well to that. They don't want to see you trying to hedge and put up a shield and act like you're perfect, because you're not. We're all flawed humans. So let's engage like that. The next one is, this is especially important for psych interns, liberate yourself from the template. A lot of psychiatry is following a template when you're practicing it, but that doesn't mean your mind has to follow the same template. And here's what I mean. Let's say I'm trying to assess for hopelessness, and I'm talking to the patient and they say, I just know things aren't gonna get better. There's not a chance any of this goes away. I'm gonna be dealing with this for the rest of my life. And I say, oh, okay. And then I look at my template and it says, is the patient hopeless? And I say, do you feel hopeless? And they go, well, there's always hope. And I'm like, do you think things are gonna get better? And they go, no, not at all. What are they saying? They are saying that they are without hope. Hope is the belief that the future has a chance for improvement, which they are declaring the future does not have. They do not believe there is hope in their situation. So when you're asking, do you feel hopeless? You're not truly asking if someone is hopeless. You're asking, do you agree with the statement, I am hopeless? Which most reasonable people will reject, especially if they sense that you're trying to frame them as hopeless. If you use your brain, like,
the thing in your head, use it!
Hey, this person is expressing that they have no hope about the future. They have a conviction that things will not improve. That is, by definition, a lack of hope. They are hopeless. And that's okay. You don't have to get them to say the words, I am hopeless. You're gonna be hey Maggie, you are a doctor of human emotion and behavior now. So you need to show that you have an expert nuance in those things, that you can understand that. Magnolia, if I have a patient that says, you're just a cootie patootie. You're purring so much. Okay, I have to film a video. Can't pour from an empty cup. You need to take care of yourself before you can take care of your patients. And that also applies to the med students. I found that when my mental health was dwindling, I was giving worse patient care, I wasn't looking forward to going to work, and I was being a worse resident to the med students. When my tires were flat because I was depressed, I was underperforming in every other aspect of my life. So it was my own personal responsibility, not just for the sake of my own health, but for everyone else, to treat myself. Hey, Maggie, Magnolia, no. There was a point when I was staffing VA emergency room consults where every patient I talked to for about 2 weeks had either just attempted their own life or was contemplating attempting their own life. The amount of trauma that I was absorbing was unbelievable. I felt myself burning out really fast. And that's when I learned, and I call this the blast doors. I really did not want to lose the soft aspect of myself. I wanted to be present with people and say that I'm a soft human. I can make these empathetic statements and really feel what you're feeling. And that was great when I was a med student. I had 2 patients for the day and I would really invest in them. But when you have to see 7 patients and their stories are all equally traumatic, you're doing no one a good service. Because what I found was, as I was burning myself out doing that, I started dreading going to deal with these patients. And they don't deserve that. They deserve good care from me, and they deserve more objective care. People are depending on you to be a lighthouse for them while they're navigating the storm, not for you to join them in the storm. So the way I think about it is, if I feel myself draining from that interaction, I put the blast door up, but it's not for my cognitive empathy. I still try to picture where they're coming from. And I think about their aspirations, I think about their fears, I think about their priorities and how I can help them achieve those things without needing to feel every emotion that they're feeling. You will get burned and you will learn from it. Getting burned is how we all learn. I have seen some awful things this year that I will never be able to unsee, unfortunately. And I have made tons of mistakes. Fortunately, none of them have resulted in harm to anyone, but it's still scary. And I think when you get burned, don't think about it as a failure of yourself. Think about it as a chance to not get burned again. And you'll see that when everyone is hung up on something or they're worried about X, it's probably because they've been burned before. I didn't push back hard enough one time on a patient who was getting cleared from the ED because they had suicidal ideation and they were medically unstable when they hit the floor. That was an awful experience. I was so worried about being that kind of person who doesn't admit patients to the psych ward, because my whole life up to this point, everyone was talking to me about psychiatrists never admit patients, psychiatrists never do this thing, they're always trying to protect our medically stable patients, and I so badly wanted to be the guy that says, I'm not like them. I accept patients. I'm one of the good psychiatrists that doesn't push back and isn't trying to avoid work. And then I went way too far on the other edge, and I had some concerns about the white count, but when I brought it up, they kind of dismissed it, and I really should have freaking pushed for it because I didn't, bad things happened. And so that was my lesson, where I'm not going to get burned again and deal with these things. And it's okay to get burned. That's part of life. It's part of learning. Which leads me to my final point, which is take a deep breath. I give that feedback to all my med students. It is such a good thing to do. You are going to do great. You're joining a lovely career and are following the footsteps of thousands of doctors that have gone before you. Every one of them has had their first day in the hospital at some point, and you're going to have yours. That's a pretty cool thing.